Hello everyone, this topic is on parturition and the representation of the fetus and mechanism of parturition. So as an introduction, parturition is the defining moment of the entire pregnancy that determines whether or not live offspring are produced. Before going into detail about the physiology of parturition, it is important to understand the basic anatomy of the reproductive tract. Parturition is the final step or process in reproduction. The learning objectives of this topic is to know the different hormones involved in parturition, to know the mechanism of parturition in animals, to learn about the advantages of controlling parturition in animals. So parturition is preceded by two very important events, the fertilization and the gestation. Fertilization occurs after sperm has entered the uterus and travels through the reproductive tract until reaching the oviduct. So when the egg is released from the ovary, it travels into the oviduct where it can be penetrated and thus fertilized by the sperm. The fertilized egg then moves through the oviduct, the uterine horns, and finally to the uterine body where it remains for the duration of pregnancy. So once the egg reaches the uterine body, it implants into the endometrium or the lining of the uterus, where it grows and develops until parturition. The fetus develops and grows in the uterus, and it is surrounded by membranes and fluids known as the amniotic sac and the placenta. When it is fully formed and ready to exit the mother's body, it rotates in the uterus and thus begins the process of parturition. So these are the different terms involved in animal parturition. For goat, it is lambing. In sheep, it is kidding. In pig, it's called farrowing. In cow, it's calving. And in dog, it's helping. In cat, it's called kittening. And in mare, it's foaling. So these are the main hormones involved in parturition: oxytocin, prostaglandins, relaxin, and the prolactin. Oxytocin is used to induce or maintain normal labor and delivery in pregnant animals. In surgery, it may be used postoperatively following cesarean section to facilitate involution and resistance to the large inflow of blood. In large animals, oxytocin is used to augment uterine contraction and stimulate lactation. It will contract smooth muscle cells of the mammary gland for milk letdown if the other is in a proper physiological state. So it is also used to expel the placenta after delivery. So how about prostaglandins? These are predominantly paracrine, autocrine hormones. For example, they act locally at their site of reproduction, production, on contiguous cells. An increase in uterine prostaglandin biosynthesis is a consistent element in transition into labor and is probably common to all species. So the relaxin is a member of the insulin-like growth factor family of proteins. Plasma levels are highest at 12 or 8 to 12 weeks of gestation and thereafter decline to low levels which persists until the term. The primary source of relaxin is thought to be in the corpus luteum. Prolactin are called as lutetropic hormone or the LTH or lutotrophin, a protein hormone produced by the pituitary gland of mammals that acts with other hormones to initiate secretion of milk by the mammary gland. So let's take a look into the presentations of the fetus and mechanism of parturition. So the presentation and positions of the fetus during parturition as well as the mechanism of death act are of much practical importance to veterinary obstetrics and demand careful consideration. The position is changed as parturition draws near. So these are also the considerations in the presentation, position, and attitudes of fetus at birth. One, in the region of its body, which is first presented for or to the pelvic inlet, and the relations of or correspondence between this region and the shape and dimensions, the pelvic cavity itself. So under the presentations, these are results from the part of the fetus which first offers itself at the pelvic inlet, that region of the young creature which the hand of the obstetric immediately meet in or on being passed into, and which is directly opposite the inlet. There are four fundamental presentations. One is the anterior presentation, posterior presentation, the dorso-lumbar presentation, and the stemo-abdominal presentation. So under the anterior presentation, the chest of the fetus presents toward the inlet and is preceded, accompanied or followed by the head and forelimbs, the situation and direction of which may vary without altering the essential features of the presentation. Ang posterior presentation naman, the croup or bridge is facing the inlet, and the presence or absence of the limbs, there only constitute varieties of presentation. So ang number 3, the dorsolumbar presentation, at any portion of the upper part of the body opposite the inlet. On exploring the pelvic cavity, no matter what part of the back is first touched, the hand always encounters the spine of the fetus, either directly in the axis of the pelvis or obliquely and at some distance from it. Ang last, or the number 4 fundamental presentation, is the stemo-abdominal presentation. The limbs in this are in reality first touch, and we may have all four, or only three, or the two. So this, however, are not the fixed point of the presentation, which is the inferior part of the body, or stemo-abdominal region. Hence, the designation. So this is the normal presentation. There should be, or the most common presentation is as follows. The front feet first, followed by the nose resting on them, then the shoulders, at the middle, the hip, the hind legs, and or hind feet and the legs. If the presentation is normal within the 1 to 2 hours after the first sign of labor, so there should be no assistance necessary. But if it's an abnormal presentation, like if the anterior presentation is where the hind feet is in the pelvis, both forelegs bent at the knees, then yung head upward and backward, and yung one foreleg bent at the knee, and the buttock presentation or the back presentation, there's a need for an expert veterinarian or an obstetrics to assist the paglabas ng fetus. So next is the positions. So the position has accordingly been defined to be the relation of a determinate point on the surface of the fetus to an equally determinate point of the pelvic circumference. So various positions which should be recognized in its presentations are, under the anterior position, the vertebro-sacral position, then the vertebropubic position, the left vertebroiliac position, and the right vertebroiliac position. So let's take a look first at the anterior position under the vertebrosacral position. So this is the most favorable and the most frequent of all, and is said to be the only natural position. So the vertebrae of the fetus correspond to those of the mother, it withers touching the sacrum of the latter, then the belly corresponding to the abdominal parietes, and its sternum to the pubis. So this is sometimes, it is named as the first anterior position. So ang next is the vertebro pubic position. So this is exactly the inverse of the first. The fetus lying on its back, it withers toward the pubis and the sternum opposed to the sacrum of the female. So yan yung second anterior position. The third anterior position is the left vertebroiliac position. So the fetus in here lies in the right flank. So its head to the left side of the mother, the neck being in the same direction, and when passing through the pelvic cavity, touching the ascending branch of the left ilium. The feet, when they are not in the pelvis, must of course be sought for on the opposite side, towards the right flank of the mother. And the number 4 is right vertebroilial position. So this is exactly reverse of the last described position, the withers corresponding to the right ilium. So the last two, or the two last, are sometimes named the lateral positions. They are less frequent as primary positions than the first two, and they are sometimes met with secondary positions after the reduction of malpresentation, chiefly the dorsal or the ventral. So the next is the posterior presentation. In this in this figure, as you can see under the posterior presentation, the group of bridge first presents at the pelvic inlet. The lumbar region of the fetus, which is the determinate point, may be directed towards the sacrum, the pubis, or the right or left branch of the ilium of the female. So there are also 4 positions as in this preceding presentation. So the lumbosacral position, the lumbopubic position, lumboilial position, and the right lumboilial position. So yung lumbosacral position, the fetus is in what some authorities have called a natural position. So, but which is asserted by the others as unnatural because the loins are towards the sacrum of the mother, then the right coxofemoral articulation towards the right ilium, and the left articulation towards the left ilium. Ang lumbopubic position naman, some of the practitioners designate this as the reverse position. So in here, the fetus in fact is lying on the back, its croup and loins corresponding to the pubis of the mother, while the limbs are toward the sacrum against which they are more or less pressed. Number 3 is the left lumboilial position. So the fetus in here is lying on its left flank, its croup and loins opposite the ascending branch of the left ilium of the female, and the limbs towards the right flank where they must be sought for if they do not present in the pelvis. So the last one under this posterior presentation is the right lumboilial position. So this is just exactly a reverse of the preceding positions. So kabaliktaran lang po ng mga discuss na positions kanina. So ang next is the dorsolumbar presentation. So in here, the fetus is presented across or transverse, and it may lie on one or other of its side, its head towards one of the maternal flanks, and the body curve like of a dog asleep. So under this, there are also positions like the right cephaloilial position, which is the fetus on the right side, which rests in or less directly in the abdominal walls of the mother. The second one is the left cephaloilial position. So this is just reverse of the right cephaloilial. Sa left side naman siya. And the third one is the cephalosacral position. So in this position, the fetus is presented by the back and in almost vertical attitude. The croup resting on the floor of the mother's abdomen. So the head is more or less depressed and directed forward towards the sacrolumbar region. So parang ganyan yung nasa figure. So the last one is the sterno-abdominal presentation. So in this presentation, the fetus offers the abdomen to the inlet of the pelvis. And on exploration, the hand first meets this part and two or more of the limbs, but always at least a hind and a fore one. So the head may be found or it may be out of reach. So the sternum and parts of the lower surface of the body can also be felt. So these are just presentations and positions, parang summary po ng na-discuss. And presentations and positions of the fetus. The anterior positions under this, my vertebrosacral, vertebropubic, right vertebroilial, and the left vertebroiliar. Under posterior presentation, andyan yung lumbopubic natin, right lumboilial and left lumboilial. Sa dorsoslumbar presentation, the right cephaloilial, left cephaloilial, and the cephalosacral. And in sternoabdominal positions, the right cephaloilial and the left cephaloilial positions. So, punta na po tayo sa mechanism of parturition. May apat na mechanism of parturition. So, ang una is this mechanism of parturition in the anterior vertebrosacral position. Na-discuss natin kanina yung vertebrosacral position. So, this is the mechanism of it. So, ang mechanism, kasi there are also different presentations. Kanina na enumerate natin. So, one of this is this anterior ito yung kanina yung vertebrosacral position, I mean. So this is the mechanism of the parturition in this position. So in this position, it has been stated that the fetus presents simultaneously with the head and forelimbs, the back directed to that of the mother and the withers towards the sacrum. Ang second na mechanism ng parturition natin is in the anterior vertebropubic positions. So in this position, the same diameters of the fetus correspond to those of the maternal pelvis. Though in practice, it is found that this position is less favorable and that delivery is always more difficult and longer than in the first anterior position. So the next is mechanism of parturition in the anterior vertebroilial position. So these lateral positions, the two in number and symmetrical, and according to the research conducted by Saint Cyr, this is rarely primary. But on the other hand, yung si Reynard, he remarks that this is sometimes found as secondary position due to the reduction of some malpresentations. So the latter authority asserts that spontaneous birth is impossible in these positions because the chest of the fetus presents its greatest diameter to the smallest diameter of the pelvis of the mother. So, ang pang-apat, the mechanism of parturition in the posterior lumbosacral position. So of the four positions in which we may have a breech or posterior presentation, only one, in the opinion of this researcher, is compatible with the spontaneous delivery. So punta naman po tayo sa controlling ng parturition in some of the domestic animals. So there are many reasons why researchers and farmers are interested in the control of parturition. It may be a matter of providing more care to the newborn by having them born at predictable time when the care and attention is necessary for survival. So on occasion, there may be need to advance or delay the onset of parturition. So like in pigs, this is the advantage of parturition in pigs. So, controlled farrowing would enable a piglet to be born during normal working day or at other times including the night, which might be considered most appropriate to ensure the survival of many young as possible. So sa cattle and sheep, this is to the control of parturition or control or manipulation of the process artificially should only be undertaken after careful consideration of the possible consequences like as management tool in preventing what would otherwise be late calvings in a herd or to help is calving and ensure the viability of the calf. So in ultra compact lambing, in farms, This could mean that osteosynchronized you, which would normally lamp down within the space of 7 to 10 days and could further align to give birth within a 48-hour period, which most lambs being born during daytime. So there might be some unusual applications such as in caracal sheep, where high quality pelts are a primary consideration. In such flux, induction of parturition has been used as an alternative to cesarean section. So in horses, this is to ensure that sufficient care and attention are at hand when the foal is born. So these are the duration of different stages of labor in domestic animals. So, andyan yung species niya, yung first stage, sa second stage, hanggang sa third stage or hanggang ma-expel or the placental expulsion. And these are also the references among these ones if you have or if you want to read more about them. So in conclusion, labor is a crucial moment of numerous species and also considered the most painful episode of females. Pain is fundamentally a psychophysiological phenomenon. However, unfortunately, pain in animals is not regularly recognized and is treated inappropriately. If parturition is painful process identified in humans, it should also be considered painful in animals. To date, most publications on labor research focus on associated endocrine modifications, and there are fewer studies related to pain in the birth process. More robust comprehension of pain during farrowing in domestic animal species can generate new hypotheses and outcomes concerning its physiology and new pharmacological therapies, mainly concerning the relevance of analgesics and the welfare implications. So these are my references. Feel free to browse on them for further readings. Thank you for listening and God bless us all. If you have suggestions, comments, and recommendations for the improvement of this topic or presentation, feel free to write it down and it shall be noted. Thank you very much.